What we've felt in Coventry is we've used technology for a certain amount over a number of years, but we really now need to take it forward as an integral part of our Home First programme. In Coventry, our key objective is to make sure that people are able to return home as soon as possible and as safe as possible, and we feel that Telecare and the wider technology and equipment is a key element of providing that support so that people remain safe in their own homes and are able to do so with the safety and security that's provided to them, their carers and their family members. What we decided therefore was to engage in a programme that really focuses on three core elements. It focuses on the systems, the processes and the culture in order to embed technology. The technology itself is really, dare I say it, the easier part. Telecare and technology is widely available. It's been around for a number of years. It's more about what is the problem that we have, what are the solutions we feel need to put in place, and how do we embed that. And obviously technology is the key element of the delivery of that. But really it's getting to the culture being the key element, making sure that all of our stakeholders are aware of what technology can do, what it can't do. It certainly is there to support individuals. It's not in place of human contact. It makes it very key for people to understand what their role is in making sure that we think about technology and every contact. So we think technology first, and most importantly it makes them aware of how to share those messages with family members, with carers, with individual service users. So very much our programme is set around those three key themes of systems, process and culture, making sure everybody gets awareness training and across all of our stakeholders, and making sure our systems and processes are correct to support the rollout of Telecare rather than being the key thing that we feed information to. The benefits of Telecare itself, I think, are very clear. For here in Coventry, what we have embarked on is to ensure that everybody that comes out of hospital into a short-term service that's provided across health and social care has Telecare as an integral element of that support. That means that a Telecare package is put in place before the person comes home, so they're safe from the minutes that they return home from hospital. And equally, if they return back into hospital, the Telecare stays in place to make sure that they always provided that safety blanket when they are home. We've managed to work, as I said, across health and social care, so that our Telecare programme is jointly funded across health and social care, working between the City Council, our CCG partners in Coventry and Rugby, our Coventry and Warwickshire Partnership Trust, and our University Hospital Coventry and Warwickshire. Certainly the critical success factors for me would be to ensure that every stakeholder understands, one, what is their role, but two, what's in it for them. So if you are thinking of obviously the family, the service users and the carers, what role is Telecare playing and how is it supporting them on a day-to-day basis? If you are working within commissioning, what exactly is Telecare or technology going to do for you, and how should you commission it? And if you're a frontline practitioner, what is your role in explaining and keeping those key messages in front, or uniform messages in front of all of our service users? But also, how's it going to help you in your day-to-day role? So really what we've tried to focus on is making sure every stakeholder has a clear message of what's in it for them. The challenges really is, as I said, we have systems, processes and culture. The challenge is very much the culture. We could put a referral pathway in, we can have a single point of contact, but we're reliant on making sure that those practitioners understand what are the risks for an individual, what are their response and requirements, and how can technology play a role in supporting them. So we're very much reliant on making sure our practitioners are very clear on what Telecare can do, what it can't do, and then passing that through to referral. So really it's all about the culture and the behaviour and making sure people are comfortable in what technology can do for them. I think keeping with the theme as we started with, that technology is the first thing we should be thinking of. It's really a case of where do we go next? We're supporting people across health and social care currently, particularly coming out of hospital, or for people to remain safe in their own homes. It's expanding the use of that technology to support people that are in care homes, to therefore ensure we can support people and reduce the amount of falls that may take place in care homes, and therefore the knock-on effect of ambulance to hospital and potential admission. It's really a case, as I said, of not the technology, it's the application, and they're therefore working with our partners to understand where next.